athletes, and I know that you have too, between baseball and football, lacrosse, all of it, oftentimes I hear a lot of athletes think they just jammed their thumb. Like an offensive lineman in the stance takes a hit wrong, his thumb just kind of feels weird, or you're diving into first base and your thumbs go out because you're stretching and you're reaching, and then let's say 2 weeks later their thumb is still killing them and they still can't play their sport. At that point they come to see you. They thought it was a jam, but you think that it might be a ligament injury. How do we go from a jam to a ligament injury, and how often does this actually happen?
It happens fairly frequently, depending on the mechanism of injury and what the patient is doing. A lot of patients will be able to pinpoint which side it is, sometimes not, but many times they kind of localize exactly where the pain is. And then typically do an x-ray to make sure there's not a fracture or anything broken, because some of these can actually be breaks. If there's no break, and on exam, if we stress the ligament, sometimes you'll stress it and be able to see if it's loose or not. To confirm whether there's actually a tear in the ligament, we usually get an MRI. An MRI, you'll be able to see soft tissue such as ligament tears, and also be able to see if this is a complete tear or a partial tear. A complete tear means the whole ligament is pulled off bone or is torn.
Oh, that sounds terrible. That just
it's
sounds
trouble.
terrible.
It's trouble. Most of these cases, if it's not torn, if it's sprained, or if it's a partial tear, usually immobilizing that joint for a little bit in order for it to heal or to get the inflammation down is the first step. If it is torn, if it is a complete tear, or if the joint is unstable, most of these patients end up having to go through surgery. The surgery, if you fix it acutely or within the first month or so, most of these or almost all of these tears you can heal well with a little suture anchor, make an incision, and repair the ligament back down the bone.
Oh my gosh,
right.
That's crazy.
If these tears are long-standing, where the injury happened months ago, then sometimes you have to actually use a ligament as a tendon and reconstruct it and use a ligament to repair and remake the tendon. Still with fairly good results, but take it a step further.
So basically what I'm hearing is we need to come see a doctor sooner than if we think we know what we're doing.
Like most things, yes. Stubborn is a quality, is sometimes a good trait, but as far as the human body, usually if it's still aggravated or painful within the first couple of days, then probably see a doctor at that point.
Well, and especially in our society, like we use our thumbs for everything. I mean,
True.
You're going to pull out your phone, you're going to text. If you hit the space bar, you're hitting your thumb. I mean, I can't imagine having a painful thumb for months at a time.
Right.
What do you do with the surgery? How long are they immobilized after that?
Most patients usually within about a month, and patients are immobilized typically with a cast for a month or so. And then after that, I typically get the patient to see you as a hand therapist. And then as a hand therapist, when you see these patients, obviously you're working on motion and strengthening and everything to kind of support that thumb.
Mm-hmm.
How quickly do patients typically get back to their sport or line of work, and how do you determine that?
Ligaments are tricky. So ligaments are, in my opinion, some of the hardest things to rehab because we have to be so careful with them. So they have a terrible blood supply. The injury itself is normally pretty bad, and most of the injuries to a ligament can be replicated in really simple tasks. So like the thumb injury that we're talking about, that little ligament, pressing a Ziploc bag can totally aggravate that ligament. How many times have you thought about, oh, shouldn't do the Ziploc? It is such a mind game to not do these things. So a large part of the first couple of weeks with me, we're working on motion, turning down the pain and inflammation, and then helping them see the things their thumb can't handle right now. Because when have we ever thought about our thumb so much until we don't have it, right?
Sure.
Sports, I say to expect around 3 months. It depends on the sport. It depends on what hand you are, and if you have to use a racket or a bat or something like that. Unfortunately, most rackets and things will fall right along that line, and that's really painful. Now, the other problem is like for football players, for instance, in that stance, and then they come up quickly, your thumb is taking double duty. Because then, if you're not up to your game, but you put your thumb back in the game, I'm afraid someone could fail. So I say around 3 months or so, but people do great, and they get a little bit faster and a little bit better. You just never know. But I say around 3 months to be safe.